Hi everybody, I'm Greg and this is Robert. So I'm a physical therapy assistant at American Career College and I'm campus. So tonight, what I'm going to show it to you with you guys, how to transfer a patient from bed to wheelchair and wheelchair to bed. So first of all, before you initiate any transfer of your patient, you better check the chart, the diagnosis, what's they're capable for, if they're minimum, moderate, or maximum assist. And before to do that too, you gotta make sure you have your devices or equipments ready. If the sliding board is needed, a pair of gloves, and a hand sanitizer if there's no available thing to wash your hands. So you always have to introduce yourself to your patient before you initiate any transfer. And with this one here from the bed, so you gotta make sure that the bed is locked. So make sure it's locked both sides, left and right. And in the wheelchair, most other individuals, they just fold it this way. Let me just move this one here closer so you can see it. So instead, folding this one here on the side, fold it that this way. So what I usually do to make sure the safety of the patient and for me it's more comfortable transferring it, so usually taking it off this one. So I'm going to set aside this one. You're going to get a better angle for your patient when you place the wheelchair. So if you transfer a patient from bed to wheelchair, you might want to take off the armrest. It's more easier. So less for get an injury. Like that. Right, Robert?
That's right.
So this is what I do this one. Some people, they just not thinking about it, the height of the bed and the wheelchair. So me, if I transfer a patient from bed to wheelchair, what I do, I always adjust the bed to wheelchair probably about a couple of inches. So it's easier for me to transfer the patient. So it's less, it's not that hard to transfer the patient. And make sure the caster wheel is facing backwards, because some people, they just leave it like this, and that might, have problems when you transfer the patient, with their feet. But you gotta make sure when you transfer a patient that you're wearing a non-skid shoe, and as well as the patient, so you have more better traction or better grip on the floor. So before you transfer, already put the deep hook here, so make sure it's snug and fit. So it's not that loose, not too tight. Especially for those patients that are taking like anticoagulant medications, so they're pretty sensitive with pressure. They easily get a contusion or what also known as bruises. So to do this, before I forget, okay? So we're not gonna do the sliding board this time, Robert is pretty much just minimum assist. So just in case, you might not need the gloves, but maybe in some hospital settings, they might want to consider you, even though just basic transfer, they want to ask you to wear gloves as their policy. So it depends on the settings or the company that you work for. So when you do this one here. So if the patient has a bad right leg, you want to consider move the wheelchair on the opposite side. But because Robert complaining pain, a little bit weaknesses on his left leg, so I place the wheelchair on the opposite side. So he has better strength here on the side. So when you ask the patient to hold you, don't put your hands here. Don't ever let them hold your shoulder or your neck. There's a red flag there. And when you transfer a patient, make sure that you're in neutral spine. So when you transfer a patient, you have to follow the patient, not just twisting it. It's not good for you. So to do this, you can hold on my, maybe just back up my tricep. So some patients, they have shorter hands, some of them they have longer hands. So they might able to hold you on your hip side, on your waistline. Maybe some patient they cannot, so maybe you can just ask them to hold in the back of your tricep. You know, they can hold it this way, so at least you have more better. You can be closer to them. Okay, Robert. Can you place your arm here? And you close your a little bit closer. Okay. You move, scoot forward for me. There you go. So to do this, you always have to count 1, 2, 3, so you're on the same page with you and the patient. So once, if the patient is capable to reach the armrest here, just in case, you can maybe ask him to reach the armrest on the other side. If not, you may just do the whole transfer without asking him if he's not capable to do it. So probably I'm going to show it to you like without holding or reaching the armrest. So I'm just going to ask him to hold my back of my triceps. That way. To do this, make sure you're holding the gait belt. And you have to count 1, 2, 3. Make sure you bend your knees. So Robert, I'm going to transfer you from red to wheelchair, okay? And count of 3, okay? 1, 2, and 3. There you go. So it's gonna be case-to-case basis. Might be easier, might be not. So this time it's easy. So to do this, you might want to back it up and lock the wheelchairs. I'm going to show it to you to placing back the footrest. So make sure it's locked. Some individuals, they having difficulties placing the footrest. So one of my tips how to do this easier is just start on the farther back. Make sure that don't forget the cluster wheels. Farther back. Then you might reach the leg so you don't hit it. And you're gonna hear that snug there, that click from this part here. So make sure it's safe. Do this in the same side too. There you go. So we're done for the part 1. So what we're going to do here, putting back the patient from wheelchair to bed, so we're just going to the opposite side. The opposite way, I mean. So as I said, when I transfer patient, I always take up the footrest. So maybe in some facility they might just tell you just to fold it, but for me I'm always thinking about safety. So I'm going to take up the footrest first. Remember, when you always work with patients, even the equipments, when you have to lower down your body, you got to bend your knees. So don't do it like this. It's not good for your back. So since Robert have weaknesses on this left leg, so if you remember earlier, I started on this side, but placing him back to the bed, I would rather to do it on this side because he has more strength on his right leg. So when you do a patient, never wheel them like backwards too much like this, because it's not good to look at. But make sure you do it on the right side. So this one here, you gotta remember to take up the other side of the armrest. And then there's some like misconceptions here. Some patient, they're not thinking, they just place the patient in the middle part. So what my perception is, I usually do 3/4 of the bed. So I usually transfer the bed here, like, 1, 2, 3, 4. So I do on the third 3/4. You okay, Robert? So in some, if the patient is that it's like minimum assist, you might want to consider to placing back the other armrest, so he can use that one to do a little bit of push when you initiate the transfer. There you go. Make sure it's locked. Okay, Robert, so what I'm going to do here, I'm going to transfer you from wheelchair to bed. So if you can help me to put your hands here. And so once I count 1, 2, 3, I want you to push yourself up. Okay? So to do this, don't use your left leg. You might use your right leg this time, so you can able to follow the patient movement. Okay? Can you scoot forward first with me? There you go. So okay, you can just place your this one here. So in a count of 1, 2, 3. Okay. 1. By the way, before I forget that, you might want to consider the height of the wheelchair and the bed. So what I do in the opposite way, always make sure that the wheelchair is higher than the bed. Probably like an inch or a couple of inches. Alright, so we're going to initiate the transfer here. In a count of 3. 1, 2, and 3. There you have it. So that's how the simple techniques or basic transfer of the patient from bed to wheelchair and wheelchair to bed. So this is going to be only for tonight, so probably that's it for the coming up videos. Again, thank you. I'm Greg, and this is Robert, and hopefully you find it helpful the videos that we showed tonight. See you soon. Thank you. Bye.